Are you curious about Zolodex injections and looking for a comprehensive guide? Look no further. In this video, we will delve into everything you need to know about Zolodex injections, from their usage to their potential side effects. Whether you are a patient considering this treatment option or a healthcare professional seeking more information, we've got you covered. Zolodex injections, a form of hormone therapy, are commonly prescribed to manage conditions like prostate and breast cancer, as well as endometriosis and uterine fibroids. By suppressing certain hormones in the body, Zolodex injections can help alleviate symptoms and slow down the progression of these conditions. In this guide, we will explore the mechanism of Zolodex injections, how they are administered, potential side effects, and what to expect during treatment. We will also address common questions and concerns, providing you with a well-rounded understanding of this medication. Stay tuned to learn everything you need to know about Zolodex injections and gain a comprehensive understanding of their benefits, risks, and impact on your health. How Zolodex injections work. Zolodex injections work by suppressing specific hormones in the body. They contain a medication called gocirylin acetate, which belongs to a class of drugs known as luteinizing hormone-releasing hormone, LHRH, agonists. LHRH agonists work by initially stimulating the release of certain hormones, like testosterone or estrogen, and then gradually suppressing their production. By suppressing hormone production, Zolodex injections can be effective in managing conditions like prostate and breast cancer, endometriosis, and uterine fibroids. For example, in the case of prostate cancer, Zolodex injections lower the levels of testosterone, which can help slow down the growth and spread of cancer cells. It's important to note that Zolodex injections only offer temporary relief and are not a cure for these conditions. They are typically used alongside other treatments, such as surgery or chemotherapy, to provide the best possible outcome for the patient. Now that we understand how Zolodex injections work, let's explore the conditions they are commonly used to treat. Conditions treated with Zolodex injections. Zolodex injections are commonly prescribed for several conditions, including prostate and breast cancer, endometriosis, and uterine fibroids. Let's take a closer look at each of these conditions and how Zolodex injections can be beneficial. Prostate cancer. Prostate cancer is one of the most common cancers in men. Zolodex injections can be used as an adjuvant therapy, meaning they are used alongside other treatments like surgery or radiation therapy. By suppressing testosterone production, Zolodex injections help slow down the growth and spread of prostate cancer cells, improving treatment outcomes. Breast cancer. Zolodex injections are sometimes prescribed for premenopausal women with hormone receptor-positive breast cancer. These injections suppress estrogen production, which can help slow down the progression of breast cancer and reduce the risk of recurrence. Endometriosis. Endometriosis is a painful condition where the tissue that lines the uterus grows outside of it. Zolodex injections can be used to suppress estrogen production, which can reduce the size of endometriosis lesions and alleviate symptoms such as pelvic pain and heavy menstrual bleeding. Uterine fibroids. Uterine fibroids are non-cancerous growths that develop in the uterus. Zolodex injections may be prescribed to shrink the size of fibroids before surgery, making the procedure more manageable and reducing the risk of complications. It's important to remember that Zolodex injections are prescribed based on individual patient needs and medical assessment. The dosage, frequency, and duration of treatment may vary depending on the specific condition and the patient's response to the medication. Now that we understand the conditions treated with Zolodex injections, let's explore the benefits and potential side effects of this treatment. Benefits and side effects of Zolodex injections. Like any medication, Zolodex injections come with both benefits and potential side effects. It's essential to understand these before starting treatment. Let's take a closer look at the benefits and possible side effects of Zolodex injections. Benefits of Zolodex injections. Reduced symptoms. Zolodex injections can help alleviate the symptoms associated with the conditions it treats. For example, in the case of endometriosis, Zolodex injections can reduce pelvic pain and heavy menstrual bleeding, significantly improving the quality of life for affected individuals. Slowing disease progression. By suppressing hormone production, Zolodex injections can help slow down the growth and spread of cancer cells in conditions like prostate and breast cancer. This can lead to better treatment outcomes and potentially improve survival rates. Pre-surgical preparation. In cases where surgery is required, Zolodex injections can be used to shrink the size of tumors or fibroids, making the procedure more manageable and reducing the risk of complications. Side effects of Zolodex injections. Menopausal symptoms. Zolodex injections can induce menopausal symptoms such as hot flashes, night sweats, and vaginal dryness. These symptoms can vary in intensity and duration from person to person. Bone density loss. Long-term use of Zolodex injections may lead to a decrease in bone density, increasing the risk of osteoporosis. Regular monitoring and appropriate interventions can help mitigate this risk. Changes in mood. Some individuals may experience mood swings, irritability, or feelings of depression while on Zolodex injections. It's important to discuss any changes in mood with your healthcare provider. Sexual dysfunction. Zolodex injections may cause sexual dysfunction in both men and women. This can include decreased libido, erectile dysfunction in men, and vaginal dryness in women. These are just a few examples of the potential side effects associated with Zolodex injections. It's important to discuss any concerns or side effects with your healthcare provider to ensure appropriate management and support. Now that we understand the benefits and side effects of Zolodex injections, let's explore how they are administered. Administering Zolodex injections. Zolodex injections are administered subcutaneously, which means they are injected just below the skin. The injection site is typically the lower abdomen, but in some cases, the upper buttocks may also be used. The injections are typically given by a healthcare professional, but in certain situations, patients may be trained to self-administer the injections at home. Before administering the injection, the healthcare provider will clean the injection site with an alcohol swab and ensure the medication is at the correct temperature. The injection is given using a small needle, and the process is relatively quick and straightforward. The frequency of Zolodex injections will depend on the condition being treated and the individual patient's needs. For example, in the case of prostate cancer, Zolodex injections are typically given once every 3 to 6 months. It's important to follow the prescribed schedule and not miss any injections to ensure the effectiveness of the treatment. Now that we understand how Zolodex injections are administered, let's explore what you can do to prepare for these injections. Preparing for Zolodex injections. Preparing for Zolodex injections involves several steps to ensure a smooth and successful treatment process. Here are some key considerations and steps to take before starting Zolodex injections. Educate yourself. Take the time to educate yourself about Zolodex injections, their purpose, potential side effects, and benefits. Discuss any concerns or questions with your healthcare provider to ensure a thorough understanding. Review your medical history. Share your complete medical history, including any current medications or supplements you are taking, with your healthcare provider. This information will help them determine if Zolodex injections are suitable for you and make any necessary adjustments to your treatment plan. Discuss fertility preservation. Zolodex injections can impact fertility, so if fertility preservation is a concern, discuss this with your healthcare provider before starting treatment. They can explore options such as sperm or egg freezing to preserve fertility if desired. Prepare emotionally. Starting a new treatment can be emotionally challenging. Take the time to process your feelings and reach out to support networks, whether it be friends, family, or support groups. Having a strong support system can make a significant difference during the treatment journey. By taking these steps, you can better prepare yourself for Zolodex injections and ensure you are ready for the treatment process. Now let's address some frequently asked questions about Zolodex injections. Frequently asked questions about Zolodex injections. Are Zolodex injections painful? Zolodex injections may cause some discomfort during the injection process, but the pain is usually minimal. The healthcare provider will use a small needle, and the injection is relatively quick. Can I self-administer Zolodex injections at home? In some cases, patients may be trained to self-administer Zolodex injections at home. This can provide convenience and flexibility, but it's essential to follow the instructions provided by your healthcare provider. How long do I need to be on Zolodex injections? The duration of Zolodex injections will depend on the condition being treated and the individual patient's response to the medication. It's important to follow the prescribed treatment plan and discuss any concerns or changes with your healthcare provider. Can Zolodex injections cure my condition? Zolodex injections are not a cure for the conditions they treat. They are typically used as part of a comprehensive treatment plan, which may include surgery, radiation therapy, or other interventions. The goal is to manage symptoms and slow down disease progression. These are just a few examples of frequently asked questions about Zolodex injections. It's important to address any specific concerns or questions with your healthcare provider to ensure a thorough understanding of your treatment. Alternatives to Zolodex injections. While Zolodex injections are a commonly prescribed treatment option, they may not be suitable for everyone. In some cases, alternative treatments may be recommended. Here are a few examples of alternative treatments that may be considered. Oral medications. Depending on the condition being treated, oral medications may be an alternative to Zolodex injections. These medications can offer similar benefits but with different methods of administration. Surgery. In some cases, surgical interventions may be recommended as an alternative or in conjunction with Zolodex injections. The type of surgery will depend on the specific condition being treated. Radiation therapy. Radiation therapy may be used as an alternative or in combination with Zolodex injections for certain cancers. It uses high-energy radiation to target and kill cancer cells. It's important to discuss alternative treatment options with your healthcare provider to determine the best course of action for your specific condition. Zolodex injections and fertility. Zolodex injections can impact fertility, so if preserving fertility is a concern, it's important to discuss this with your healthcare provider before starting treatment. Depending on your situation, they may recommend fertility preservation options such as sperm or egg freezing. For men, Zolodex injections can cause temporary or permanent infertility. It's important to discuss the potential impact on fertility and explore options for preservation before starting treatment. For women, Zolodex injections can cause temporary infertility, and fertility may return after treatment is completed. However, in some cases, fertility may be permanently affected. Discussing fertility preservation options with a reproductive specialist can provide guidance and support in making informed decisions. It's crucial to have open and honest conversations with your healthcare provider about your fertility concerns and goals to ensure appropriate support and guidance throughout your treatment journey. Conclusion and final thoughts. Zolodex injections are a form of hormone therapy commonly prescribed to manage conditions like prostate and breast cancer, endometriosis, and uterine fibroids. By suppressing certain hormones in the body, Zolodex injections can help alleviate symptoms and slow down disease progression. In this comprehensive guide, we have explored how Zolodex injections work, the conditions they are commonly used to treat, their benefits and potential side effects, administration process, and how to prepare for treatment. We have also addressed frequently asked questions and discussed alternative treatment options and the impact of Zolodex injections on fertility. It's important to remember that Zolodex injections should only be taken under the guidance and supervision of a healthcare professional. Each patient's treatment plan will be tailored to their specific needs and medical assessment. If you are considering Zolodex injections or have been prescribed this treatment, make sure to discuss any concerns or questions with your healthcare provider. They can provide you with the necessary information and support to navigate your treatment journey successfully. Remember, knowledge is power, and by understanding Zolodex injections and their impact on your health, you can make informed decisions and actively participate in your treatment plan. Thanks for watching.